I earned my PhD from the University of Puerto Rico, School of Medicine in San Juan, Puerto Rico. And when I finished my PhD, I moved to Boston to do a postdoc job at the Harvard Medical School at Brigham Women's Hospital. I was there for 10 years. I was promoted to instructor. And in 1999, I received an email from a colleague of mine, Jose Lopez. He used to work here at Baylor. He sent me an email asking me, you want to come to Houston? So 3 months later, I was already here with all my family, and we were pleased. That happened in the summer of 2000. So we have been here for almost 15 years now. Well, thrombosis started when I was doing my PhD with Dr. Ganguly. He published seminal papers in terms of platelet receptors. So we were interested to study bleeding problems in uremic patients. I started doing my PhD work, collecting samples from these patients on the dialysis. We isolate a protein that may be related with the bleeding problems in this patient. That's my first encounter with bleeding problem. Then I moved to Boston under the supervision and mentorship of Dr. Robert Andin. And the first 4 years of postdoc, I worked with von Willebrand factor, which is a critical protein in thrombosis as well as in hemostasis. And that's when I become more interested in this area. Inflammation happened here in Houston. When I moved to Houston about, I would say maybe 6 years ago, I started working with a protein that might be involved in thrombosis and also preventing thrombosis, I would say. And we noticed a direct link between thrombosis and inflammation, and that's why I get interested in inflammation. So that's my new area. It's my new field, I would say. So five years ago, with my colleague Jin-Fei Dong, who used to be here at Baylor, he noticed my interesting observation by using this protein. And this protein, what it causes is just prevent platelet adhesion and thrombus formation in vitro on fibrinogen surfaces. He said to me, there's a model here at Baylor by an animal model for DIC, which is disseminated intravascular coagulation. And one of the hallmarks of this disease, of this problem, is fibrin deposition. And he said, why you don't inject your protein in his animal? So I approached this another colleague, Trong Nguyen, and so we injected into these mice. And then he said, wow, this is fascinating. Why you don't apply now for the ALCAC award, to start. So we did my first attempt. It didn't get funded, but then after that, the following year, it got funded. So, and since then, I've been blessed for the last 3 years. I've been funded from ALCAC award. It provides funding to buy a new system to purify proteins. It's a new equipment. It also allowed me to buy supplies, reagents, to pay also salary for 2 staff technicians, buy animals like mice and pigs, because they were doing also on pigs, and also allow me to make more collaborations with other colleagues nearby here at Baylor and other institutes here at Medical Center. Not only allow me to collaborate, but also to provide some funding to sustain some of the projects. For example, with MD Anderson, which is one of the projects ongoing right now. That preliminary data for the first 2 years, I get the ALCAC award. It's the lay or the foundation for this R01. And of course, I'm very grateful for the award. And not only that, this award was obtained from our first submission, which is rare in these days, and it's because of the ALCAC. And not only that, the ALCAC helped me to submit another R01, and of course the STTR. So I will summarize that at least 3 grants is based on the ALCAC award. The first observation in vitro was that this protein prevents platelet thrombus formation of fibrinogen. Then we moved to this mice model, or DIC model, that they have fibrin deposition in vivo. And the A2 rescued 100% of this animal. And that was a fascinating observation. because it's a link between thrombosis and inflammation. That's when I move now to inflammation. We move to graft versus host disease. And my colleague at MD Anderson, she heard about it, what my protein was doing, and she said, it may work in my model. And I asked why? Because there's some correlation between inflammation and thrombosis in this animal model. And she has some ideas that later she explained me, but I just said, sure, why not? Let's just give it the A2 domain. So in long story short, she performed experiment using this graft versus host disease mice model, and so far she has tested 3 times, and each time with 10 mice per group, and so far we have 90% survival versus 40%, and everybody's so excited. Besides that, because when I noticed that observation, I said, some people have described similar mechanism in terms of IBD or inflammatory bowel diseases. So we obtained, with the ARCAD funding, I was capable to buy mice that developed Crohn's disease after 4 weeks they were born. And again, in short, to be summarized, those mice treated with A2, they gain weight slowly, they look normal, active, eating, drinking normally, compared to those mice who only receive just the buffer. They get very, very fat, morbid, they cannot even move very well, and so that's very exciting observation from the A2. So far we have at least 3 applications for this protein, for DIC, GVHD, and Crohn's disease, or IBD. In the future, we're going to test it in colitis because it's very related to Crohn's disease or IBD as well. It's been great for me, especially in applying for my first STTR, or small business grant, with the help of Andrew Wooten, which has been supportive for the last 1.5 years, and I thank him a lot, almost every day. We've been communicating almost at least 2-3 times a week. He's very faithful in responding to my phone calls or my messages, and he just introduced me to this new venture in move the A2 protein into the commercial business, right? He arranged interview, also presentation for different companies, and also right now they're helping me for the second resubmission of the STTR grant. On the purpose of the phase 1 STTR, we're moving now to test the A2 protein without the his tag, without the fusion tag, in order to, in anticipation to use in human. Phase 2 involved the use of pigs, and I can tell you that we already have preliminary data using pigs with the A2, which is also very intriguing results so far. The ARCAD Foundation has supported me in buying pigs and getting all these new results. First of all, we're using the mass spec core lab to identify a potential ligand for this A2 protein. In addition, we'll be using the mouse gene core, and we are preparing ES stem cells for vimentin. And right now, currently, the mouse core, they're helping us to create our first vimentin flux mice. The idea is to create a conditional knockout, vimentin conditional knockout mice for platelets and also for endothelial cells. And once we got all these mice, we're going to be isolating these cells, and we're going to be using all flow cytometry, all the imaging system. And about a year ago, for the Crohn's disease work we did with the mice, we used the NMR core facility for rodents. It was also very nice results as well. I think the turning point is the moment that I see something that most people or nobody else notice. What I mean with this is that a person, I would say maybe a scientist, that maybe is different from others, and I see or I notice or I perceive that I should do this or I should do that, and sometimes, many times, you can see your colleagues or maybe manuscript or reports that said, we have done that already. And maybe people asking, why are you going to do it? Someone already published, so it's not going to work. And I have been listening to this comment since I was a postdoc. And many of my papers is just trying to answer those questions that people told me, no, don't waste your time. And that usually is my turning point every time. It's not one in my career. I think it occurred many, many times during my career. And it happened when I see something, I said, I want to investigate this, I want to know why this happened. Even though someone already reported, I said, what about if I just change a little bit the methodology, the procedures? Maybe I'll look for something different. And the same thing happened with the A2. The A2 protein, we thought that the only function is to be cleaved by an enzyme. And I said, let me just try. And I just tried. And the same thing with these animals. We thought only some thrombosis. Now we know this also could be it's involved in inflammation. And when I get that kind of results, immediately my mind is open, and I feel like a student. I feel like I had to go back to college, and I start to educating myself, reading new materials, new vocabulary for me in order to learn more and know more about this new subject. So I think turning points, I would say, happen many, many times during my career. And the most important is I keep my mind open to new things. There are a few. First, keep the faith, believe in themselves, and follow the guts. The guts tell, just do it. It's worth to try. Do it. And as an example, I can tell you that I've been doing many experiments, sometimes without any explanation, sometimes without any hypothesis driven, but I just wanted to do it, see what happened. We got some interesting results. At that moment, I don't know how to explain them. So what I do is just to keep those data in my drawers. And then sometimes 2-3 years later, I go back to my drawers and I say, now it makes sense because I'm working with something. And it came out to my mind, say, I remember to see something similar in the past. I open my drawers and voila, here we go. And then now I explain. And I go back to those 2-3 years, even 5 years back. And I can show you a few of my nice articles published. It's coming from results obtained maybe 5 years prior to the publications. So never throw away your data. Never believe that your data is bad. It's just a matter how to explain, how to fix. And sometimes we are ahead for the real explanation. Maybe you get a result that in that moment you don't know how to explain, but 2 years later, now you can link with another new experiment. That's what I suggest to the career, to these assistant professors or young investigators or students, just to keep your mind open, and again, it's just to enjoy what they're doing.